While senators are on the Hill today at work to end the deal, to get a deal on the shutdown, raise the debt ceiling, House members are back home today after efforts toward a House plan collapse. On ABC this morning, bickering between Republican Congressman Rural Labrador and Democratic Congressman Keith Ellison showed just how far apart the parties remain in the House.
There's a number of things we could do, but we cannot do it under the gun as we are now. So
we just offered you a 6-week extension of the debt limit.
6 weeks no good. You want to do this again, right? 6 weeks. You want to do this again in 6 weeks?
So what you want is you want to get everything you want, and then you say that you will negotiate.
I want to take.
Will Congress ever be able to reach a compromise? Joining me live now, Tennessee Republican Congresswoman Marsha Blackburn. Congresswoman, we are starting to see some glimmers of hope in the Senate with Harry Reid and Mitch McConnell talking right now. We have not seen a great deal of talk across party lines in the House. Have you guys essentially rendered yourselves irrelevant in this fiscal standoff in the House?
I would say quite the contrary. My goodness. We have sent the Senate 4 different continuing resolutions, and I think all but one of those had bipartisan support. We have sent them 16 different funding bills. We've had about 200 Democrats in the House vote with us on those measures.
You mean the piecemeal bills to open the government?
Yes, it's called appropriations, Craig. That's how we go through filling out the budget every year.
I'm familiar with appropriations, Congresswoman.
Yeah, and that's exactly what we do. That's how we go about it.
I would ask you, why open the government piece by piece, part by part, when you can open it entirely?
We didn't want it shut down in the first place.
That's not my question. Why not open the government entirely instead of piece by piece? Very simple question.
Well, and I can give you a simple answer for that. What we wanted to do is make certain that we address the funding issues of this. We have sought to have the Senate address our appropriations bills. They didn't do it. So we said, okay, if you want it even in smaller bites, we'll send it over to you in smaller bites. So that's what we've done. They wouldn't take action on a budget, didn't do a budget for years. This year they wanted us to tell them we were going to give them everything they wanted in order to negotiate. So then we sent them continuing resolutions, and they didn't want those. So then they didn't take up our appropriations bills. So we said, well, we'll send you these one component at a time. Now, I don't know how much more simple we can make it for the Senate than that.
Let's move from that crisis to the one that's coming up here in just a few days. I meet the press this morning. International Monetary Fund Chief Christine Lagarde, leading voice on the world economy, said that the threat of a U.S. default this week is, quote, very, very concerning. Take a listen.
One thing was certain around the table. It was that if there is that degree of disruption, that lack of certainty, that lack of trust in the U.S. signature, it would mean massive disruption the world over, and we would be at risk of tipping yet again into recession.
You've been adamant that you will not vote to raise the debt ceiling without significant spending reforms. If you don't get what you want here, are you still willing to risk default despite domestic and international concern?
Well, we made an offer on the debt ceiling and asked that they negotiate and work with us. You've had 53 lifting of the debt ceiling that have taken place over the last 4 decades, and 27 of those brought about spending reductions. All of them have had negotiations involved in the process. We have asked the President and we have asked Harry Reid to please meet us at the table and negotiate this through. We're incredibly concerned about it.
Why would you vote to extend the debt ceiling by just a few weeks or a few months? Why would we want to revisit this?
In order to allow time for negotiations, because they've been unwilling to meet us at the negotiating table, so we said, fine, we'll give you a short-term lifting of it if you will agree to sit down and work with us.
You will
on
give
the debt ceiling, on the budget, we've got
when you say you will give them a short-term, when you say you will give them, you mean Democrats, or you mean the American people?
We are talking about having the President and the Senate work with us on this issues and deal with the long-term spending problems. We cannot continue to borrow $2 billion a day. $2 billion a day to keep the lights on, and that is what is currently happening.
I don't think a lot of folks would disagree.
It's unsustainable.
I don't think a lot of folks would disagree that having a conversation about long-term spending is a legitimate conversation to have in this country.
It is a legitimate conversation.
I just agree with you. But I think a lot of folks take issue with how that conversation is being had.
We've been trying to get them to work with us for 5 years on this issue.
Last question really quickly here. You've been, of course, a steadfast opponent to Obamacare since its inception. Yeah. According to this new NBC News Wall Street Journal poll, the law is actually gaining support now. 38% say Obamacare is a good idea versus 43% who say it's a bad idea, a major bump from the 31 to 44% it polled at just last month. How do you dispute the fact now that digging in your heels in opposition to the law seems to be making more people in favor of it?
Well, what we have to realize is Obamacare started out as an $863 billion access to insurance program. It is now, according to the Congressional Budget Office, a $2.6 trillion takeover of health care. Yes, I am. I mean, it's too expensive to afford.
That wasn't the question. You just gave me a talking point, and the question was, how do you respond to the fact that the approval numbers...
I gave you a fact, not a talking point.
But you didn't answer the question. The question was, how do you respond to the fact that the law itself seems to be more popular now than it was just a month ago?
I guess people are choosing sides. What we do know is that the website doesn't work and it is more expensive. The cost of insurance is skyrocketing in some of these plans, and people are paying more and getting less. That's the result we're hearing.
I'm out of time. At some point, we should have you back, and we should carve out 10, 15 minutes for a conversation. Congresswoman Marsha Blackburn from Tennessee, I always appreciate you coming on. Thank you for your time.
Sure.